educate and encourage your women to motivate you through whatever you've been going through. We can talk about it. We ain't passing no judgment. So don't be ashamed. It's all the same. Stay in your lane. Your lane. It's whatever your real life looks like. Stay in your lane. Come out the dark and don't be ashamed. Your lane. Let's have a conversation on what we face every day. Tune into your late talk show. It makes us feel good just to know we're not alone. No more will we feel isolated and cast aside. I want you to come out the dark. Just don't be afraid of your heart. So don't be ashamed. It's all the same. Stay in your lane. Your lane. It's whatever your real life looks like. Stay in your lane. Come out the dark and don't be ashamed. Your lane. Let's have a conversation on what we face every day. It's your Lane Talk Show with Coach Trish Hannah.
Hello, hello, hello. Welcome everyone to your Lane Talk Show with your coach Trish Hanna, broadcasting live from the beautiful Nassau, Bahamas. Woo, today is not really that hot. It's about 39 degrees or so. I mean, it's not hot to us. It's like small things, right? I don't know how it is with you guys in the other countries. I don't know if you're wearing your little sweaters now, your little fleece. I don't know what you're wearing now, but put it in the chat. What are you wearing? What would you put on your pajamas? You put on your blanket? What you wearing on this beautiful, beautiful Sunday? Let me let y'all know for those who are tuning in for the first time. Your Lane Talk Show was created to educate, empower, and encourage women of all ages. All right. Although it is a women's talk show, we do have men tuning in from time to time. As I've always stated, you have men who try to call in the show to win some of our prizes, right? We love y'all. We love y'all. It's okay. It's okay. All right. Of course, we do have men who stop me on the side of the road or stop me in the food store and be like, hey, you Coach Trish. I listen to your show. Thanks for tuning in. I just want to big up all the men that tune into our women's talk show. We have a lot of information. Some of the information we have, of course, is needed for you. You want to know more about us. And then, of course, we have shows where we have men on and in studio so that they can talk to us about y'all. So it's a gift, it's a win-win situation here. Now let's talk about last week. Last week we had with us Coach Tammy LaCroix, intimacy coach. And listen, she was talking about building our sexual confidence. Uh, uh. Man, she came with all our bells and whistles. We spoke about ways to improve our sex lives, things to help bring spice into the bedroom. All right, for couples. And of course, we were able to answer a few questions. She spoke about toys, whether it's allowed or disallowed. She spoke about positions. She spoke about communicating, the importance of communication. All right, when you like something or you don't like something, where you want this or you don't want that, whether you've been through trauma and this is, something that you have to hold back on, all of that was discussed last week. It was so much fun. For those who missed out on that big show, all right, you can tune into episode 70. Just go to Your Lane, um, Coach Trish Hannah on YouTube. Sorry, Coach Trish Hannah on YouTube, or you can go to Your Lane live coaching on Facebook to watch episode 70. And of course, it's called Building Sexual Confidence. All right. I'm not going to say much more on that because I don't want to spoil it. I don't want to be a spoiler. For those who did not listen and tune in, go and check it out after this show. Yeah. Now, I need you to go and share this page. Share the page, share the page, share the page, share the page, because we as women, we always talk about fixing each other's crowns, right? We want to make sure not only if their crown is fixed or if it's not fixed, we want to make sure that their hair is fixed underneath the crown, right? We want to make sure that their hair is properly taken care of. We want to make sure their skin looks good. We want to make sure that our sisters are um able to get the right information, right? When it comes to taking care of our skin and taking care of our hair. We want them to feel good. We want you to feel good. So you don't want to just be going out, dressing nice, and you got little dandruff flakes on your shoulder. You got little dandruff flakes coming out your hair. You don't want to be dressing up and looking good and you patching on makeup, but your face looks rough and dry, right? We don't want that, right? So guess what we have for you? We have with us on live today Dr. Jamie Davis. But of course, I need y'all to tune in though. I need y'all to go call somebody and tell them tune in rather. I need you to go call them and say either go to star 106.5 FM dial. You can go to channel 976 on cable for those who are listening here locally in the Bahamas. Or you can watch us on Facebook at Your Lane Life Coaching Facebook page. All right. So I'm excited about Dr. Jamie with us today. She is a board certified dermatologist and she come in packed because we've had a last year on a show. I think it's episode 15. So you can go and check that out as well. And in that particular show, she came in, said what needed to be said, but she was not given the sufficient time or enough time to really share, like deeply share what we need to know. Because there were some things that were shared, um, but it was not a certified dermatologist that shared that information. And I have to be careful by the way that I word this. And so, of course, there was a bit conflict, as far as information is concerned. And Dr. Jamie is here to clarify all of that. All right. She's coming to clarify all of that. I promise you. She's going to give you the truth, the whole truth, and nothing but the truth today. So I would predict today's episode is 95% aha moments because you have to get rid of what Grammy them used to say about how to do your hair and wash your hair and what to do to your face and wash your face. So let's see what Dr. Jamie has to say because of course this she's a professional with this, all right? Um she's gonna share all of that because that ain't me. I just stick in with just talking to y'all. All right, she's a professional here. Your Lane, episode 71, taking care of my skin and hair. It's brought to you by Airborne Freight and Cargo Services, John's Shoe Store and Accessories, Your Lane Life Coaching, Bahama Odds and Ends Party Supplies, Neutrogena, distributed by Lowe's Wholesale, and Women of Strength Association. Women of Strength Association presents the all white women's empowerment gathering under the theme Beauty from Ashes. It is a pearl and fascinator affair. All white casual dress with accent color shades of pink. Ooh, if you feel like dressing up and looking pretty and dazzling, go right ahead. I encourage you to go ahead and be a part of this event. This is an empowering conference for women for all walks of life and ages. The conversations include mental wellness, relationships, boundaries, balance, and breaks. Happening this Sunday, October 8th from 4 p.m. to 7 p.m. Your investment is only $50, which includes drinks, light refreshments, and giveaways. RSVP is required, so call or WhatsApp 423-9377. That's 423-9377. Now, if you want to be a part of this event, because it sounds like fun, unfortunately, I can't be a part of it, but I want you to be a part of it. This is actually right in the middle of my show. All right. I want you to be a part of it. I want you to text this number 376-8689 and say, I want to go to the all white women's empowerment gathering. And that ticket is yours. The first person to text and say, I want to go to the all white women's empowerment gathering gets that free ticket. Okay. The number to text again is 376-8689. And if you feel as if, you need more than one ticket, because sometimes when you go, you won't go with your friends or whatever have you. So you call this number 423-9377 to get more information about how to purchase that ticket. Once again, I call it an investment because you're going to learn about, once again, relationships and boundaries and balances, and you're going to have time to socialize with other women, and of course, the information is on the screen for those who are watching via Facebook. So you have an opportunity to read a little bit more about it and get Further information by calling the number, I'll recite it again, 423-9377. Neutrogena celebrates all breast cancer survivors this October. To know your body is to love your body. We stand with you and we honor you and your fight. Head to any of the Lowe's wholesale pharmacies for your Neutrogena products and support breast cancer survivors with Neutrogena. Now, without further ado, I'd like to introduce Dr. Jamie Davis. Dr. Jamie Davis grew up in Freeport, Grand Bahama, and attended Freeport High School. She left the Bahamas to attend Mayo Clinic Medical School in Rochester, Minnesota, and owns a private dermatology practice in Minneapolis. Dr. Davis now travels to Nassau and Rock Sound to practice at the Family Medicine Center. She specializes in medical, surgical, and cosmetic dermatology. So, without further ado, let us welcome once again Dr. Jamie Davis.
So good to be back with you.
Woo! How
So
are
good.
you?
Well, good. Thank you for thinking of me for this. Be back in Nassau early November at the clinic. Also Rock Sound. We have a clinic in both places, and always happy to see people with issues, not only with their skin but also hair.
Yes,
And we see a lot of it. We talked a little bit about that last time we were together.
yes.
But we do see a lot of hair issues, and this is a great topic for men also. So get your
Mhm.
men friends to tune in if they're not already. But
That's right.
we see a ton of issues with men and the shaving related
Mm,
hair folliculitis. Absolutely, we should do a whole segment for men. I'll tell you, there's like enough
yeah,
information to
I
support
love
that.
that. I love that. In fact, if we have questions coming in, of course, we can ask questions about the men as well. But the last time for those, what she's referring to, that's episode 15, hair care and restoration. So you can go and tune into that on your on YouTube. Um, episode 15, hair care and restoration. Now, Dr. Jamie, there are so many questions that I have to ask.
Ask
Of course,
me, ask me.
limited time. Um, but of course, I think this is a question that I asked you the last time you were here, but just for those who are listening to us and tuning in for the first time, when you do practice here in the Bahamas, I mean, not that I think that it's a cultural difference, but just say here locally, what are some of the main reasons why women come to see you regarding their hair and skin?
So that's a really good question because there is a bit of a difference
There is.
there versus here, for example.
Mm,
So, as you know, and I'm familiar with this just because I have, pretty coarse hair, but with curls, with more ethnic hair, the closer we get to really kinky, coily hair, the less washing there is. It's just not as possible, especially when it's straightened or dreaded or whatever. It's just not possible to wash the scalp as much. So we start to see more scalp related dermatitis or inflammation, what we would call dandruff essentially.
mhm,
And so to come in and just say, well, wash your hair more is not a practical piece of advice. So we have to consider the hairstyle and the skin together. And that's something that's a little more unique, again, to what patients I see down there in
mhm.
uh, in the Bahamas. When I say down there, I'm in Minnesota right now. So in Nassau and Rock Sound, we see a lot of scalp issues from the inability to wash the hair as much.
Wow. Well, amazing. I'm in St. Rocktown. I just came from Luthra yesterday,
Yes,
actually. Oh my gosh, so beautiful. How
yes,
could you stay on that island and then say you have to leave to go on a flight to go somewhere else? It's like,
I
the,
know.
the water, the ocean is just so beautiful, so tranquil, so clear. Oh, this is for my international people, y'all. Please, I mean, you could just choose and refuse whichever island you want to go to, but I suggest that you please visit the Bahamas. Okay. All right, let's get back on track there.
I agree
So,
with you. I agree.
with dandruff, all right. How is it formed? Is it only because a person does not wash their hair? Because I've heard people who would wash their hair and they would use certain shampoos, but then within months the dandruff, it comes back, it returns. So how do you deal with that?
You're absolutely right. So dandruff is an inflammation of the skin, little dermatitis or eczema, but it is generally caused by an overgrowth of a very normal little yeast that lives on us, Pityrosporum ovale, which is a little yeast that lives on us normally. Our skin has a lot of normal inhabitants that, if they are given a chance to overgrow, will cause problems. And this Pityrosporum yeast, which lives on our skin and our scalps, loves our own oil. It thrives on our overproduction of oil. Shampooing your scalp removes that oil and can reduce then the ability of these yeast to overgrow and therefore not create as much itch and flake. So the shampooing piece of it is important to remove your own oil. It's just that if we can't do that, then we have to kill the yeast via a different mechanism. And that's where medicated shampoos come in. But just what you said is true. You use one like a Head and Shoulders, or I love the Neutrogena products. I'm glad we have a Neutrogena sponsor today, because the Neutrogena T-Sal, T-Gel, as
Yes.
well. Yes, as well as a Nizoral shampoo, Head and Shoulders, Selsun Blue. They all have a medicine in them that helps reduce the number of those yeast, but they also have ingredients that lift away oil. So they're very handy, but these yeast are clever and they will become resistant very quickly. So I like to have a rotating cast of shampoo in the shower. So I'll have a Neutrogena T-Sal, maybe a T-Gel also, and a Head and Shoulders, and a Nizoral. And you just rotate through on a daily basis, or
Daily?
oh yeah, it's a little high maintenance, because just what you said is true though. If we stick with just one, it'll do a good job until those yeast become resistant. And not crazy resistant, but just they're like, oh, this, doesn't, you develop a new colony of these yeast, they adapt quickly, and they're like, well, Head and Shoulders doesn't work anymore. Right? So the way we combat that, and I hear exactly what you said, I hear that all the time, like, I used it and it helped, and then it stopped helping. Right? So if you just keep it rotating, Monday this one, Tuesday the other one, Wednesday the other one, or if you're not washing daily, that gets a little, we have to use more strategy. We might do 2 in one session. Like if you're just going to wash once a week, we might let Head and Shoulders sit there a minute, rinse that out, and then we might use a T-Sal, let that sit there a minute, right? So we have to be strategic. Just what you said is true. Exactly. Everybody has the same experience.
Or is there something that we can use to help restore? Because I know certain shampoos, like medicated shampoos, they tend to dry out the actual hair
Here,
particles, follicles. And so it feels hard and like, ugh, especially for people, with our coily type hair.
yeah,
So how do we restore that?
right. So you're asking exactly the right questions, because that's the other thing is these shampoos, shampoo in general is meant for scalp generally, right? So these shampoos, especially dandruff shampoos that are medicated, they're not only carrying a medicine, they're carrying a very potent surfactant to get oil off your scalp. So they are inherently very drying. So even if you don't have sort of, coily or curly or hard to manage hair, it will dry out your hair. So you must condition. So just like shampoo cleans the scalp and soap cleans the skin, you have to condition to moisturize the hair like you would have to put moisturizing cream on the skin to moisturize it. So you have to a little bit undo the cleansing process with moisturizing. So shampoos are not really for hair. Conditioner is. Shampoo is for scalps, but so that's the tricky part. Even when you co-wash or wash with a conditioner, which I do a lot, it doesn't necessarily clean the scalp enough to get rid of that dandruff. So they're competing interests, really, when you think about it. The scalp wants one thing, the hair wants another thing. So we have to be practical. We have to be practical, and I can't just say wash your hair every day, because it's just not going to go like that. Right? So you have to condition, but I often just trust my patients to know what their ideal ratio. I just say, well, what's the most you think you could wash without really messing up or drying out your hair?
Mhm.
But we have to find that limit or we just struggle with the scalp. So what I was going to say is yes, shampoos are one piece of this. But there are, if we cannot harness the shampoo to get the job done entirely because of the limitations of dry hair that you pointed out, then we say, well, can we medicate the scalp to kill these yeast without having to strip the oils off the scalp? It's trickier to do, but yes. And that's where prescriptions such as topical steroid liquids, and I've prescribed those to many Bahamians. You put that on your scalp and it calms down the dermatitis, calms down the itch. Um, we'll try to even use sometimes surface anti-yeast medicines, a little harder to do.
Mhm.
Rarely anti-yeast pills because it's not really a long-term deal, right?
Mhm.
Um, and then maybe that helps to get away with less shampooing. But it's this tricky balance, it really is, between scalp and hair.
It is. So other than dandruff itself, dermatitis, what other scalp issues seem to be? I mean, I don't know, 'cause
Yeah, there are other things.
I don't I know, but, like, I don't know, I don't wanna say it's a forgive me, I don't wanna say it's a color thing or it's a, type of hair thing, but is it really, you know, black versus white or coily versus straight when it comes to, hair care?
There are things. There certainly are things. And that's really where we get into the men's issues
Mhm,
because the only time that I see the actual type of hair causing the problem that it wouldn't cause if the hair were softer and finer, right? And so then we do get into, you know, sort of the African hair type, and also mine's Italian. It's not quite as coarse as you're gonna find there, but if this stuff curls like it wants to, it gets really tight. And so then men, for example, they shave the back of their head, they shave their face, sometimes they shave their scalp. And when those little coily hairs try to grow back, they almost corkscrew into the skin itself. And then we see pus, pimples, like folliculitis happen. And
mhm.
that is 100% based on this coarseness of the hair. So, absolutely an ethnic, if you will, cause of that. Because if, some a guy with, fine blonde hair, for example, shaves, it doesn't corkscrew back when it grows out, right? So, this is where we see a ton of this in the Bahamas, this pseudo folliculitis barbae, which is this folliculitis of ingrown hairs on the beard.
Mhm.
Also, they, get a nice close fade in the back, looks good, but man, that causes some bumps.
Let's talk
Even
about that then. I don't mind sharing that. How can that be treated? 'Cause I've seen it a lot in men. I've seen
yeah,
it
we see
yeah.
so much of it when we're down there. And here's the thing, the trickiest part is you just have to stop shaving for a minute. Let those hairs actually grow out. Sometimes you have to pick those out because they're just like a little splinter in the skin.
Mhm,
So to pick those out, let everything calm. We put antibiotics on the surface, sometimes pill antibiotics, and as well as some things to soften that upper layer of skin so the hair doesn't really get caught as much. Let
mhm,
that hair grow out, let everything heal. But men want to shave. So we either use like a shaving powder, and you can get that at stores there. It's like a depilatory powder. I think you mix it with water, like Nair would be for women, like, or what we would put on our legs, those
mhm,
creams.
mhm,
So men can use that, or women too who get ingrowns. But so that's one thing, or maybe even trim rather than shave. So use a clipper, but not right down on the skin, so that those hairs never get pulled underground in that sense.
mhm.
And women get this on the bikini area, on the legs also. It's like
Yes.
a lot of people get this. But I see so much damage, like keloids, like scars on the back of men's necks. Look around. You'll
Mhm,
see a lot of that. And it's from these super close tapers, the fades that they get. So they really have to rethink their look.
mhm.
And so,
You do
you know,
have some jobs that require us, clean face, shaved face.
Yes.
Faces. I think most military places, police officers, I know for sure, they have to shave their faces. And so, how do you deal with? Or you said to use some type of powder with mixture, water mixture, whatever have you to put on your face. But what if it's already there? What can they use? Is there a prescription or over the counter medication or something to help?
Yeah, so that's when we would use either surface antibiotics like clindamycin, we prescribe that all the time,
Mhm.
or pill antibiotics until these things heal up. But the real key, it's like if you had a splinter in your skin and it was festering, you wouldn't just give antibiotics without removing the splinter, right? It would be futile. So with these shaving related bumps, we have to make sure that those hairs are all free out of the skin. We don't pluck them out, we just lift them out. Like if the hair's here, we'll just kind of lift it to be straight and then let the skin heal around it. And then use a shaving powder or something to kind of get that basically that shaved look again. But it's that sharp barb from the shaving that just makes it corkscrew down in the skin. So yeah, antibiotics on the surface, um, things like lacthydrin or amlactin. I think you can get those there. They have lactic acid or even salicylic acid. Neutrogena makes a beautiful salicylic acid face wash. It's in the acne section, but it's also very good for softening for this folliculitis issue.
We
Um,
also women. I don't think they would shave, but they probably use tweezers, and then you see like the little black marks or markings on the chin.
mhm.
How do you get rid of that?
Yeah, so that is maybe two reasons for that. One is, yes, when you pluck a hair, you really rip that follicle. You're literally ripping this little sheath that the hair lives in. You're ripping it from the skin. So there's a little bit of a micro tear inside that follicle. And over time, that creates sort of a little, almost a small scarring process in a sense. And the inflammation from that can bring pigment in. So, yes, all these little bumps. Plus, as that hair grows back, if it is curly, it can also embed in the skin and get little ingrown hairs.
Mhm,
So that's another case where we might do the shaving powders, or the Nair for faces, or these liquid, sort of a chemical shave instead of a pluck or a mechanical shave. And in
mhm,
some cases, and I don't have access in NASA, but some cases a laser can help, or electrolysis, where a little electric current is passed into the follicle to just try to kill that little follicle.
mhm. And speaking of faces, why is it that well, moles are formed all over our body, but particularly our faces. Why are they formed? 'Cause one minute you see one minute, but you would see someone with flawless skin, no mold, and this is proven because there's somebody in our office. And then a couple months down the road, you see like moles on their faces. How is it formed? Is this genetic?
Yes. So what you're referring to, I believe, we see that I call them Morgan Freeman spots, because Morgan Freeman actor has these little dots on the cheeks, almost
Mhm.
look like from a distance like freckles, but they are little. We call them dermatosis papulosa nigra, nigricans, or nigra B or DPN, dermatosis papulosa nigra, DPN,
Mhm,
almost like little skin tags. They are fairly unique to African skin types.
mhm,
Don't We see little skin tags and other kinds of keratosis growths, benign growths in all skin types, but this particular one is, you'll see it more commonly. That may be what you're seeing in your colleague or friend. Those are easy to remove. They are not worrisome, but DPNs, and you can Google that, or Morgan Freeman face, and you'll see them. They can be removed if somebody doesn't like them. They're some people really, they're bothersome too, and some people just embrace them like little freckles. But sometimes they get kind of dangly and catch. So we snip those, or I cauterize them gently. Um, so we can take care of that anytime if somebody's bothered by those. They're never cancerous, but it's always good to make sure. It's just in darker skin, we're not going to see as much skin cancer. So I don't really worry about them for that, but
wow.
just mostly if they bother somebody in the way they look.
Right. And so when they're taken off, just before we take a break, do they leave scarring or it's just
So
skin?
generally not. But you make a good point. Anytime you cut or cauterize the skin, especially darker skin, you can be left with a little bit of hyperpigmentation, but generally it's less obvious than the mark itself. And a lot of times nothing remains, but it is a risk of doing it.
There's a risk? You're
No, but
saying
that is the risk of doing it.
just the
That is
scar.
the risk, is just leaving little tiny brown spots behind. Otherwise, there's really not much of a risk. But yeah, trading a tag like brown thing for just a little flat brown spot. Women tend to not mind that because then they can use a foundation that covers it right up, whereas they could not cover up when they were raised.
The raised
Um,
ones. Yeah.
right? So yeah, we do that and we sometimes do a few and see how it goes. And if the patient loves it, we do the rest.
hmm All right. I want to talk a little bit more about that, but let's take a quick break. I really want to talk about moles because we do have a colleague who's really interested in me asking a few questions, which I will
Sure.
right after this break. Okay, so Dr. Jamie, we're on a break now. So of course,
Sure.
with that, people can still watch and tune in and listen to us live. All right. So just quickly, I want to cover a little bit more about the moles, as I've stated, and then I want to talk about, oily versus dry skin
Mhm.
thereafter. Yeah. And then what type of, like, when you go to, let's say, the pharmacy or a local dermatologist, when you ask for, face regimen, of a regimen or routine, what are some of the things that we should be doing to take care of our skin daily? So those
Yeah,
are just some
important.
heads up for when we come back from commercial.
Yeah, important. We're going to save people a lot of money too by talking about that.
I love that.
Yeah, less money, not more money is what we need to spend on that. We
Yeah,
just got to spend it in the right places is the problem.
that's the problem. That's
Spending it
the
on not the right things is the thing. So.
My issue is dry skin. I don't know if it's because I'm not drinking enough water, but I've had issues with, and I'm always in the air condition. I don't know if that make a difference.
Big
Uh,
difference.
yeah, yeah.
Yeah. Oh yeah. Let's talk about when we get back. We should talk about, so make a note. I just don't have something to make a note with, but about, dry versus oily. What did you mention? Okay, moles for sure.
Well,
Oh, and
the
then skincare
routine,
products,
right?
basically. Yeah, exactly. Myths. Let's talk about facts and myths because
Okay.
it's an industry fraught with marketing. Well, we'll talk about that. Fraught with marketing messages that may or may not be true.
hmm
And sunscreen for dark skin, even.
hmm
It's not just for it's preventing skin cancer, it's for preventing pigment.
Welcome back. For those who are just tuning in, we have with us dermatologist Dr. Jamie Davis. She's here all the way in Minneapolis, Minnesota right now, but that's okay because, thank God for technology, right? We
Yeah.
want to be informed about things pertaining to our skin. Just before the break, we were talking about moles and how it's formed and what can be done. So real quick, Dr. Jamie, when you go into this, well, how long does the process take for you to actually get rid of the moles? And then how long is the healing process?
So if we're talking about these DPN bumps on the face, different than actual moles, which we can address in a moment,
Mhm,
to get rid of those, it's super quick.
mhm,
Generally, we do it at the same visit where I see you for consultation. I just pull out my little cautery pen and buzz, buzz, buzz. Depending on how many there are,
mhm.
or snip them. But it's super quick. The downside is you'll feel it a little bit. It's not bad, but you'll feel a little pinchiness. If they're
Hold on,
large,
hold on. Back up. You have a little pinchiness. I need to know because
I
we are
know, I know.
doing too well. So how much of this pinchiness we can feel? Do I need to y'all need to numb my face or something? What y'all need to do? Because this
We
ain't
can, we can. But like if you pluck a hair, right? If you pluck a
what
hair,
it
it's
can
not
feel.
pain free, but it's not like bad. It's like plucking a hair, but it's a little snip. I mean, it pinches like a pinch,
I don't like pinches. I'm kidding. I'm kidding.
but I can numb
Okay,
your
so,
skin.
so that can happen the same day of consultation. And I know you probably may not share this, but roughly an estimate, like how do you determine how much the cost would be to get things out? It depends on how many you have on your face. How's that
Well,
structured?
sort of. So generally, let's just say that you're coming in if just exclusively for that. Generally speaking, if you're using insurance, the insurance pays for the visit, and sometimes then we just snip them and let the office visit rather. So there's two ways we bill: a visit and the procedure. If you're
Mhm.
coming in for the visit, let's say you're paying $150 for a quick visit, and we do those. Often we just roll that into your 150 for the visit, depending, but sometimes then we charge for how many. And it would end up being, probably for, a dozen of those, another 125 or so.
Okay, that's not
Right?
bad.
Yeah. So it's not bad. No, and honestly, just realize this: you're going to find different you're going to find skincare treatments and visits priced very differently around the islands, and I think they're pretty expensive. What I'm trying to do there is provide really good quality care at very reasonable prices. We're not here to alien or to prevent people from access by money issues, or by overcharging. So we charge very reasonable rates. We want to make it fair. We want to make it a great value for your money. We obviously have bills to pay
Yeah.
at the clinic. But yeah, just so everybody knows, skincare does not have to be crazy expensive. It simply does not.
I love that. I love that. So I think I've covered the mold thing. I know I've covered the what do you call it? DP,
DPN, yeah,
and
those
the little
little Morgan Freeman
I have
spots.
the
You
little
know which ones I
I have
mean.
the tattoo on the side there, and I think it's pretty cute. I don't want to get rid of mine. I'll keep
Well, and
mine.
they can be cute. Like I said, I sometimes I think they're really cute on people, like little freckles, and as long as
You
they're
know,
not.
nowadays this is something that I guess I would say African American people do. They used to get like this eyebrow pencil and just put a mole right on the side of their lip.
I'll tell you.
You
Oh
know about
yeah.
that? Yeah.
Oh hey, I have a little one somewhere here. Full of mascara on it.
Wow. Yeah. So that was, so I celebrate my three little freckle looking DPNs or whatever they're called, and I'm gonna leave
Yeah,
them.
I wouldn't take it off you if some people come in, they have a mole that's really actually pretty cute. Like, Cindy Crawford, imagine her without that
Yes.
mole,
Now
right?
I can't have the big old ones would look like the witches now. No
Yeah.
offense. I'm just saying, those ones would be like you ever watch let me not say that. When you're talking to someone and it's really beyond the size that it should be, and you
I
call
know.
them their mole instead of calling them their name. But
I
it's
know. Well, Aaron Neville, who's an amazing singer from the Neville Brothers, but Aaron Neville has a mole that has his own Facebook page.
oh there.
Yes. He has a mole right here. I
Wow.
think he still has it, but that thing has a life of its own.
Of his own,
And,
yeah.
and
But I mean,
he's
not to laugh at the situation, but then because some people it might be unique to the individual. Like
yes,
how's
and
everyone
there's nothing wrong
celebrating
with
his
it.
own? Yeah. So
There's nothing wrong with it. It's just that it's such a feature for him. Nobody in their right mind would remove that mole from him. Just like
wow.
nobody in their right mind would remove Cindy Crawford's mole. Or
No,
there's a
unique
lot of
to them.
beautiful characteristic moles, but just that, yeah, some are more distinctive than others. And as long as there's nothing wrong with them, leave them
No.
be. So I don't take things
Mm,
off. Just I have to be very careful because you don't want to change somebody's fundamental look.
exactly. That's unique to them. And so that's actually
Right.
what we want to say. So don't mind us just laughing. Of course, that it's not like we're trying to, to degrade or downgrade or, your uniqueness. That is unique to you.
No, and we'll always respect that. Always respect that.
Always respect, right, and of course who we are as women and men for those tuning in. And I want to get the men in because we can be talking about some stuff too with you all, and then of course we'll have a show specifically for you guys. But let's talk about our skin routine. Let's talk
Mhm.
about what we should be doing versus what we shouldn't, and then some of the myths and some of the facts. 'Cause
Yes.
yes, we do hear a lot of myths pertaining to skin, or get this particular brand because this brand does this, and then when you use it your face feels so tight. It just feels so raw. Just when you after you use it, you're like, I will never get this product again.
Yeah.
This makes no sense to me.
So here's the thing. A lot of times the way skincare marketing happens is unfortunately not very personalized to the individual. It'll be this product is good for everybody, but there is simply no way that can be the case
Mhm.
because everybody's different. So the benefit of talking to me or a professional in this regard is we start with you, not the product, right? And so if somebody says, "Oh, I didn't like that product," I mean, the next person might say, "I loved that product." That's
Mhm.
because they have very different skin than you.
Mhm.
So the essential components are very simple. Yes, we should cleanse our skin morning and night. And then you, with your drier skin type, might use a different product than I might use with my more oily skin type. So then we would say, well, for drier skin types, there are, these products that tend to be more compatible. Neutrogena makes a gentle foaming cleanser, and maybe Cetaphil makes a gentle non-foaming cleanser, right? So you might want the non-foaming, doesn't lift away as much oil. I need the foaming because I want that oil lifted away, right? So we have to just be specific to what our goal is for that particular skin type. So yeah, I might, and I change seasonally. With winter, I'll go to products more like what you would like, a little
Mhm.
more creamy, non-foamy cleanser. And back in the summer, I go foamy. Certainly when I'm in the Bahamas in the summer, foamy, right? Get that oil off.
So you just
Um,
taught me something. So the foamy helps with
think
the
Yes, getting oil off. Think about this. If you have you cooked some peas and rice and use lots of oil and you got to clean that pot, you're going to put it in hot, soapy water. You're not
of
going to clean it in cool water with cream, right?
no.
Like with hand cream, right? So you won't get the oil off. So what the mistake with drier skin is we use too harsh a surfactant, like the foam. If it foams up, it's lifting oil off you. And if that water's too hot, you're also, thinning and lifting oil away. So we need a cooler, creamier wash for dry skin and a hotter, foamy wash for really, really oily skin. So men can get away with a little harsher skincare. Like sometimes they just wash their face in a hot shower with their body wash and they get away with it, right? But
Yes.
not you, not probably not me, but not you. So there is no one way to do it that is best. So match your cleanser to your skin type. And there are so many, even if we stick with the Neutrogena line exclusively, they have a whole spectrum of products from gentle, creamy through mildly foamy to medicated acne wash, right? So we just say, well, let's see what your skin responds best to and pick one that's most compatible.
Mm.
That's step one. So that's the cleansing step.
You said something though. It kind of mashed my toes a little bit. You saying something about the hot water, man. Like I have to listen. My
What?
skin has to turn a different color after I finish with the shower. I mean, you wouldn't even know that we have mirror and glass in the bathroom after I come out of the shower. And
Okay.
I know that that is an issue, and then I complain about my dry skin, but then I still go back in the hot water. So
Yeah.
that's the
Well,
problem.
it's
I
good
know.
for the soul. A nice hot shower is good for the soul, especially in this cold weather here. But
It's
but
cold already.
not yet. It's getting there.
Oh,
It's
okay,
getting
okay.
there. But when it gets cold here, everybody's in hot showers. It's like your
Mhm,
only break from it.
mhm.
But you just have to realize that hot water, like heat melts butter, right? So hot water is going to melt the oil off your skin and it'll rinse off. And what you need is to preserve what oils you have by not overstripping them.
Right.
So for sure, if you want to use hot water, for sure, the next step is important for you, which is then let's replace some of those lost oils, right? Or replace some of that lost moisture after you wash. And that's step two, which is moisturizing.
Mhm.
So just realize this, moisturizing is only if you need it. So people who wash their face and they don't feel tight and they don't feel dry may not need a moisturizer. It's not an absolute requirement for maintaining the health of the skin as long as you didn't strip it by washing it. Um,
You just dispelled the myth
yeah,
because, yeah, without saying too much, I was told on the show that you have to moisturize your face every single time you wash it.
you might, but not necessarily. So if somebody has very oily skin and they wash and they pat dry and they leave the sink and they don't feel tight or dry, they don't have to moisturize. Moisturize is only a replacement for oil that you stripped from washing, right? We pay the price of stripping a little oil just to clean our face, to get the makeup off or like whatever dirt from the day or sand if you've been at the beach, or salt. But
Mhm.
what goes with that is some oil comes off, and you might need to replace that oil to just balance out your skin. So, but that is a might need to, right? So for me, I need to. If I wash, usually in order to sort of feel clean, I do strip a little extra oil, then I just moisturize it back on.
Mm.
And for me, then I combine it with a sunscreen. And that might be the thing I would advise is, let's say you're going to moisturize in the morning, use just a moisturizing sunscreen. It doesn't have to be 2 steps. But get Neutrogena makes great ones.
Mhm.
So many brands, but a gentle moisturizer that has a little sunscreen in it, or plain if you don't need a sunscreen that day, or if you're doing your nighttime moisturizing, right? Because that has nothing to do with skin aging. What it has to do with skin aging is sun protection, actually. The
Yeah.
myth comes where if you imagine old, wrinkly skin, it looks dry, but it is not actually dry. You can have very old, wrinkly, oily skin, right? And so the moisturizing is just to replace what oils you would have washed off in the process of cleansing. But it's the sun protection that helps minimize aging, not the moisture exactly, right? So old skin isn't dry skin, it's just skin that has had the collagen breakdown, right?
Mhm.
Your skin is always going to look so much younger than my skin at the same age. It's just going to, because you have built-in sun protection. I do not. I got to get sunscreen on. Right? Does that make sense?
Yeah. Yeah.
Yeah. What
Something you just sorry, go ahead. Go ahead.
I was going to say, we're going to save people money because you can simplify your program so much by understanding why we're doing what we're doing.
Mhm. So, you said something, on our break about because I talk about how I'm always in the air condition. Like,
Yeah.
the
Oh
sun
yeah.
and I, we're not really friends. As soon as we come outside, "Gee, the sun are they?" And we try to find a shade, we try to find something or whatever have you to cover ourselves from the
Smart,
sun.
smart.
I'm
Well,
always
I was going to say, so your question was, am I not drinking enough water? Right. So here's the thing, when skin is dry, genetically, usually it's genetic, like you're just born with oilier or less oily skin, dry skin. So there are several different just fundamental types of skin. But if you're just one who has drier skin, generally you don't produce as much oil. Oil is there to help, just like if you, let's say you put Vaseline on your skin, the water doesn't get out, it stays in, right? So this concept of moisturizing is simply to hold your own water in your skin, right? It adds a little other factors, but high hyaluronic acid in these moisturizers, for example, binds and holds water in your skin, right? So your skin needs water. It doesn't need like oil from a product.
Mhm.
So moisturizers literally are to hold water in. They can be greasy because then they really hold water in, right? So when you go out on a hot day and sun hits your skin, water evaporates out,
Mhm.
right? You're probably plenty hydrated, right? If you weren't hydrated, your skin would be the last place it would show. You'd be dizzy, you'd be feeling thirsty. So certainly stay hydrated, but that's not what your skin won't be the place that shows. Your skin just will not be the place that shows. So when you look dry from the outside, it's not because you're not providing enough from the inside. It's because it's evaporating out really fast. And that hot sun will make it do that.
You just dispelled another myth.
There's
Go
so
on.
many.
I
There's
love
so
what
many.
you're doing.
There's so many. We call that transepidermal water loss, TEWL. And that means the water you lose through your skin. And people can become yes, they can become dehydrated that way. And it's a significant source of water loss. If you collect that all up on a hot day in the Bahamas, you manage to collect that up on somebody, like if they lived in a bubble or something, it would be like measurable, like a liter of water or something like that on a hot day. It's not trivial. So you have to drink water, but your skin doesn't show dehydration first. But what you want to do to prevent transepidermal water loss is seal that in. And that's where, yes, a moisturizer. If you wear a Band-Aid for too long on your skin, how it gets all white and mushy,
Yeah.
like white, that's hydrated skin. Right, it's overly hydrated, but that's it. That's holding water in there, so that skin is plump and juicy. It's a little much. You take that Band-Aid off, and within an hour, you're back to like normal skin. It just
Yeah.
evaporated out, right? So moisturizers are doing that, but on a kind of a controlled level. So yes, moisturizers are important, but it's not something like a dogmatic. Everybody must moisturize every day.
Mhm.
In the summer, I don't want moisturizer on my skin. It's too oily. I mean, it
So
just gets oily fast, but I put a primer with sunscreen to get the sunscreen in a dry feel.
right.
So we talked about cleansing. We talked about then moisturizing and sunscreen as your second step in the morning, or just plain moisturizer at night if you need that.
Mhm.
And then the next sort of thing to talk about in terms of good basic skincare is sort of then, what are your goals? Are your goals acne management? Are your goals anti-aging? What are your goals? And that's where then talking to somebody, you can't just say you need this product, because what if it's not what my goal is?
Right.
Right? I see people, in their teens using anti-aging products. I'm like, that what you need now is sunscreen, not an anti-aging product, right? You need to prevent aging, not try to reverse aging,
Mhm.
right? But as we march through the decades of our lives, the goals may change, and the
Mhm.
products we will benefit from will also change.
Here's the thing.
How,
I've seen older people, I say older, I was more mature people, let's say the ages of between 30 and about 45, 50,
yep,
that still from time to time have pimples,
yes.
we always thought that pimples were only for the youngsters, the teenagers. So what causes that then?
You're asking some really good questions. We could do a whole episode on this one too. So, yes, teenage acne, hormones, right? I mean, as your body is maturing, men and women alike, but especially the guys, they're producing testosterone. They're growing. If a young man is growing, he'll probably have acne. Same with a woman. When she gets her first menstrual period, these hormones are changing. Hormones affect hair follicles.
Mhm.
So juices up the amount of oil we produce, and it's usually gummy oil, and it plugs up the pores. You get kind of the blackheads, comedones. You also can then get little pustules. So different type of acne than a woman in her 30s, right? So then we're starting to get into what we call adult acne, and that's not just teenage acne in adults.
Mhm.
Different deal. It can look similar, but it's not necessarily just straight up driven by hormones like in the teens. It is, however, driven by sort of the hormones of adulthood. And women often notice a cyclic change in their acne, especially around the jawline, related to some aspect of their menstrual period, either
Yeah.
before, during, after, right? And
Mhm.
that's all generally, it's a hairline, it's jawline, that says hormones. Um, First, we check to make sure that your hormone levels are actually normal. Women produce testosterone normally, but if you produce too much, we have polycystic ovary syndrome or something like that. That's a whole nother thing. We need to know if you have that.
Mhm.
Right? You can get excess hair growth, you can get unexpected weight gain, some diabetes like things, a little darkening of the skin around the back of the neck, under the arms. So we want to watch for that, right? So adult acne Young women can get that too. But in an adult woman, I'd like make sure we don't have PCOS. Okay, let's say you don't, all your hormones are normal, but you might be extra sensitive to them. And some people are just genetically. And
Mhm.
stress will bring that out. So then you have young women, 30s, early career, a lot of pressure, maybe young kids at home. Life's stressful if you're a go-getter in your early 30s. And so stress will also create a little more sensitivity to your own normal levels of hormones. And so we'll see stressed out women, not only with their menstrual cycle breakouts, but just sort of the background of stress in their life make them more sensitive. So we get this sort of stress acne,
Mhm.
right? And generally it's a woman thing, I would say. Generally it's a woman thing. We do see men with adult acne, but it tends to be less of a hormonally driven thing. Well, less of a cyclic hormonal driven thing. Sometimes they're just, well, certainly if they're taking testosterone as a supplement, like for bodybuilding or something, right? Or people in transition between female to male, if they're transitioning gender and take testosterone, or athletes who might take testosterone for athletic performance, right? So we'll see men and women with who are taking testosterone get more acne, right? So we have to just find out the why of the acne first and foremost, because you can't just buy a product and expect it to work if it's driven by testosterone excess that you're producing in your body, right? We have to fix that first.
Mhm. Okay. That's actually important.
Yeah.
But then there are men with pimples, like one or two, probably on their face. So is that so let's see if this is a myth or not. Eating too many fatty or oily foods, does that cause pimples?
No, is the
John?
short answer to that. So your body, when you eat butter, let's just say, when you eat butter, your stomach acid breaks that butter down. Your colon digests all the fragments and brings these essential fatty acids in, and then your body does with them what it needs to do. It'll make whatever it'll make sebum or your natural normal oil, but it won't make excessive. Like you don't just if you eat fat, it doesn't just come out as intact fat molecule in your skin. Your body breaks it down, takes the calories, takes the portions of it. Just like eating collagen doesn't just come out in your skin as collagen, you digest it as protein, and your body delegates where to send those protein
Mm,
molecules. You might be working out, your muscles need them, your skin's not going to get them, right? Or whatever, or it'll get what it needs. So when you eat fatty foods, it doesn't just juice up your oil glands.
mhm.
Generally speaking, though, I always recommend a healthy, well balanced diet
Yeah.
for health reasons. It's not because we want to reduce your acne. If you're eating too many fats, your acne is the least of my concerns. Your blood vessels are my concerns,
Yeah.
right? Right? Heart disease, etc. Right? So as a physician, I'm also very mindful of the whole body's role in all of this stuff. But yeah,
Absolutely.
diet is a tough one. There are certain things that might make people break out, but not in a direct way. Like if I drink red wine, for example, or eat super spicy food, redness and little pimples. So rosacea is another cause of adult acne.
Mm,
Generally lighter skinned people, but not always. Usually
mhm,
like Irish. So in the Bahamas, we see it because you
mhm,
get a lot of the northern, sort of lighter skinned Bahamians who have Irish or English backgrounds or
mm,
um, that will break out from rosacea, which is a flushing cause of the acne. So diet in terms of foods that open blood vessels in your face, anything that makes you hot, even walking out on a hot day could do this, or hot showers.
mhm.
Not in you, okay, but like so yeah, diet in that sense can, but not because you ate something fatty or you ate even eating dairy. A lot of people swear cutting back dairy helps their skin, and it may be because some dairy will create a flushing type of it just stimulates the oil glands because of the flushing. It doesn't You're not allergic to dairy or sensitive to dairy or have lactose intolerance, right? That's not the reason it helps your skin. It's just that it might reduce flushing. So there are some dietary things, but you'll notice when you come see an experienced board certified dermatologist and you have acne, we don't, unless it's rosacea, dig into dairy and fats. It's just not the way it works.
Is there a special way to um dissolve the pimples in your face? Let me just use darling
Yes,
the bump, the burst the bump.
yes.
Can you know we come on now, let's be real here. We babies, I don't know if this is everywhere, but we like to get our little fingernail and just get to the bump and just squeeze
I
it,
know. I
you know?
love that you're saying that. I love that you're saying that because I'm right there with you. There is no way I'm walking out the house with a big old pimple on my face. You know you're going to try to pop that thing.
Mhm.
But there's a good way to do it. So, first and foremost, let's wind back a little. Let's try to prevent them best we can,
Right.
right? So, yes, the best way to manage pimples is on the front end of preventing, not on the back end of, well, pop it and dry it up, right? But now and again, one will break through.
Mhm.
So that then leads me to the next piece of our, we'll talk about how to pop them in a second, but we had washing, we had sort of moisturize and sunscreen, and now then medicate. What are your skincare concerns? If it's acne, then yes, topical retinoid like Retin A or tretinoin or retinols, right? Neutrogena makes a great retinol over the counter with a hyaluronic acid moisturizer built right in. I love that as a starter. That softens the surface, prevents blackheads, prevents pimples. We do prescription strength of that stuff too, right? So that would be at night. You would wash, moisturize if you need it, pop a little retinoid on there to prevent all over, not just on a pimple. We might also use a topical antibiotic like clindamycin or benzoyl peroxide is one too. So
Mhm.
that's where we get into what are your particular goals. Let's say a pimple gets through, some rogue pimple pops up, um, and you got pus, and you're not leaving the house with that thing. I don't blame you. There is a right way to do it. Fingernails are not the right way, but you just take it, clean it with alcohol, take a little pin, like a little safety pin or sewing pin or needle or whatever, and you just want to pop it, right? Don't pop it hard, but just try to break the surface. Um, and then what I like to do is take a Q-tip and roll over it, just gently press out the pus. You're not digging down with fingernails like poking down.
Mhm.
If you do want to use your fingers, careful with the nails, but use the pad of your finger and press down on each side of the pimple so that the pus will come up and out. Problem with popping a pimple where you haven't ruptured the surface, and if you push kind of the wrong way, the pus goes down in your skin. And then we have a bigger problem. Now we got pus forced under the skin, makes more of a mess, more of a scar.
It
The
does.
problem, yeah, the problem with the fingernail piece of it is you end up taking off skin that didn't need to be removed. Like you end up taking off a chunk of that surface skin and then
Mhm.
making this open area, right? So a clean pin, roll a Q-tip or press with the soft part of your finger down on each side and let that pus come up and out. And certainly use your medications to prevent. You can pop a little um, retinol or benzoyl peroxide on after just to kill some bacteria. But just remember that the pus, just get it out. Don't have to like dig it out.
Mhm. I was in Walmart a few months ago, and I noticed that they had like
That tool.
this tool, like a kit. Yeah, there's this kit,
Love
like
it.
three different things, and number one in particular was similar to a huge needle. Of course, the opening is about this big, and then this is this long thing. So, is that
Yeah.
something you would recommend without it having to mess
So I
up
have to see,
on your face?
well, I have to see what's in that kit. But so there's usually a little thing with a loop on it. We call it an
Yeah.
extractor, right? It's got a loop. So we use those all the time to extract the harder bumps that are under the skin, or even to for a regular pimple.
Mhm.
You have to pop the surface gently first. So I don't know what this long needle thing is that you're talking about, but a
Mhm.
clean, sharp poke in a pimple will then, and then you use the loop to helps force that pus up and out is reasonable. But what you don't want to do is go on a hunting expedition all over your face with your 10 times magnifying mirror and just start digging around, right? Um, if you can gently extract a couple blackheads, that's fine. But usually people come away, and I'm guilty as anybody, come away from their 10 times magnifying mirror with all these things they tried to squeeze, you know. But so if you have a big one, use a kit like that. You have it up on the screen
I'm trying to
or up on your phone?
Beats. I don't. Well, can you look up pimple popper kit for me and put it on the screen for me, please? I don't know if you're able to see it from here, so I'm gonna let him do it. Pimple popper kit. It
Yeah,
has
let's see what that is because I don't
different tools.
condemn those. I think they have utility. We just have to use them correctly and not go on a hunting expedition just to pop everything on your face. And also,
Mhm.
what I can help with is for you to know what cannot be popped. There are little bumps or
Pimple
things.
popper. Excuse me. Just
Yeah,
no, type in pimple popper. I'm looking at it from Amazon.
maybe I'll dial it in
Popper
too. Let me
kit.
look at pimple
Sorry, go ahead.
on Amazon. You say?
Yeah, I'm looking at it from Amazon now. There's one that I just clicked, and there's like one, two, three, four, five, six different tools in it.
Okay, I'm looking it up.
And I'm like, this can be.
Copper toolkit. I got it. Let me see what I got. Okay, yeah. See the loops? Well, let's get the anybody who's listening who has their phone handy. It's under Pimple Popper Toolkit or something on
He's
Amazon.
looking. He's gonna put it on the screen.
There it is. There it is. Yeah, that's what I've got up to. So the thing about that, see all the loops.
Mhm.
You really just need one of those, I guess, or it's just different sizes of loops. Yeah, see that?
So would you
So that
recommend
sharp
this?
thing, yeah. So that sharp thing, but you could just use a sewing needle, just the same. And then even like the loop of a bobby pin, right?
Hmm.
Because you basically have that at home. That's what that looks like to me is the loop of a bobby pin. So your cheap version at home is sewing needle and a bobby pin.
Okay, make
Um,
sure you put your little alcohol and clean it thoroughly and quickly. And,
yes, that's key because we don't want to add bacteria and we don't want to spread around bacteria.
right.
So
Yeah.
clean it thoroughly on the skin. But yeah, so the loops can also, if you see a blackhead or open comedone with that dark plug in the center, just gently press down on it and it'll just lift up from the skin. And that's the retinoids or the retinoins, retinol helps soften those so they're easier to come out. But it's actually quite normal to have pores. Some of those pores will have oil that dries on the surface. So washing, moisturizing helps keep those a little soft too.
Mhm.
And also then the retinols can soften those up. So yeah, if you're prone to blackheads and pimples, then we take that angle. If you're not, and you want to do more anti-aging stuff, then we do a different set of products, but what's that one? Oh, that's like a little vacuum sucker thing. It's
What is
oh,
that?
it's a little vacuum sucker for blackheads. But you could do this, yeah, you could do the same with like a bobby pin or that other kit.
Beats going all high tech, man. It ain't that serious.
I
Just
know, no, but
everything on the screen.
27,
Okay, so
$27 just get a retinol or something, you don't need a fancy kit. But yeah,
I
it'll
like
suck it right out.
I like how you use that, right? I like how you said that you could just get a hairpin and a needle. Of course, you sanitize it and everything. But what other things can be done to help with facial care and health care? I mean, making sure that our faces stay healthy. Beats, you running out now. Could you please cut?
Okay, so that thing,
What is that?
that thing, so that's for anti-aging, right? So there's some theory that this red light and blue light stuff, but how much is that thing? $399, forget it.
No.
Because that's to rebuild collagen, which is okay, but we can do it with a Neutrogena retinol product for 20 bucks. We don't need the blue light. It's fancy, it's fun, it sells, and people want fancy, fun things, but there's no magic in this. This
That's
is common sense. If less you made of money, buy one, fine. But they're way cheaper and more accessible ways to manage. So yes, and I love answering those questions. People say, "What is?" Well, there's a hair cap thing you can put on to grow hair. I'm like, well, plenty to talk about there.
well, let's talk about that.
What?
So hold on, let me just close up. Let's close up skin. Is there any other myths that you want to dispel before we get into? Because I want to talk about
Yes.
alopecia a little bit. and hair
Yeah,
loss.
that's good too. Okay,
Yeah.
so other myths. So when you think about a typical skincare program, if you just look up one online, there's like 1,000 steps. Well, it's like 5 or 6 steps. Cleanse, tone, moisturize, active serum, sunscreen, blah, da, 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 right? So again, what are your goals? Let's simplify it down to the basic things that take care of your goals. So
Mhm.
cleansers, washes in the old days used to leave an unbalanced pH on the skin. So a toner was a pH resetter. It reacidified the skin. I call them reacidifiers because soaps would be of a more basic pH. Your skin likes acid pH. A toner would bring that pH back to where it needs to be.
Mhm.
These days, soaps don't mess up the pH of your skin. So a toner is a marketed step that people think is important, but it's really only important to the people who are taking your money to buy their toner.
Mhm.
Um, Sometimes they used to be a little alcohol based, and they would sort of really sort of squeaky clean your skin, but it would overstrip most people. So if you are going to use a toner, fine. If you enjoy that, fine. But there's no real point in it. Um, Other than just enjoying the feeling of it, but you may then actually need a moisturizer because you just took off what last remaining oil your skin had, and that's okay. um, Eye cream, neck cream, forget it. Just use a moisturizer and use sunscreen. Your eyes don't need a different cream. Sometimes they'll do a thicker cream, like a thicker small quantity. You pay more for those creams than you do for gold per ounce. So just be really mindful of that. But you can use just a little, denser over the counter like Cetaphil or CeraVe
Mhm.
thicker cream under the eyes if you feel like you need more moisture. But again, eyes don't age because of lack of moisture. So that's the fallacy. So then neck, okay, neck, sunscreen. Just put sunscreen on your neck. That's what keeps necks young is sunscreen, not
Mhm.
neck cream, right? And so, no, it's a fact. So all these things that profess to reverse a lot of that aging, really, we talked about it, retinol.
Yeah.
Retinol does that, not whatever's in this other expensive cream that's for your neck, Um, Fine, use them all. Like again, I said, if money's no object and you like having a whole routine, that's not essential. It may be fun, and there's snail serum from Korea that people. Then there's it's all just trying to what can we market that will make people buy it, thinking it's the
And
latest.
people are buying it. I mean,
Oh,
to
and
each
they're
his
buying
own.
it because it's fun and they, hope in a jar is what it is. You're selling a myth that this will do something for you, and it will certainly hydrate you, right? Most of these things are fancy hydration, water delivered to your skin, right? Water is the key. You could just soak with a wet washcloth and then put some kind of cream over it to hold it in. You'll get as much moisture as you will from a $100, $200
Oh.
snake serum. Yeah, for sure, right? If you understand that's hydration, right? So hyaluronic acid, love it because it binds like 1,000 times its weight in water, holds it on your skin. And then you can, to hold it in there, sometimes just the hyaluronic acid's enough. But, then put a little light moisturizing cream over the top to hold it all in there. I mean, the ultimate version of that was this thing they're calling slugging, where you put an active on and then you put Vaseline over the top,
Mhm. Mhm.
right? So you're just occluding the active and the hydration in there. That's just that then you get all this Vaseline. And I love Vaseline for skincare, but not like that much Vaseline. You can start to clog your pores.
So
So,
just
right?
before we go on this break, all right, because we're gonna wrap up on another break real quick. I just want to know for those who wear makeup daily, because you got to go to work, you have to, have your face a certain way. Um, and of course, when you come home, what are the type of products that we can use? I don't put on makeup every day, of course, when I do the show, and maybe if I have to go to an event, but I'm not a makeup person like that.
Mhm.
But what can we do, or what is a really good cleanser to help remove all the makeup follicles from the face? Because I noticed that sometimes even when you use a particular product and you wash your face, and let's say you use a white towel to dry your face, you notice that you still have a little bit of the residue from the foundation or the powder.
Yeah. Well, so yes, because the skin is basically like a little cobblestone with little pores everywhere. Every hair follicle has, a little indentation around it, and inevitably the makeup will settle into those areas. So, thing one, sometimes putting a primer. So a little sort of a dimethicone primer. They feel kind of velvety, but putting a primer to sort of like pre it's like a little spackle. It pre-fills all the holes so that when you put your makeup on, it's not going into the pores. It's sort of setting on top and easier to wash off later. Also, try to stick with water-based makeup that then rinses with water. If you need to do a little deeper cleanse, then an oil-based cleanser. Even so, creams are basically oil all emulsified into water. It's like if you put oil and water together and then blend it, and that's how you make a cream. So it's really oil in a little bit of a water vehicle. So a creamy cream cleanser, I mean, Pond's was sort of the gold standard for a while, just to kind of help dissolve some of that makeup, or an oil cleanser. So, they're different brands, but an oil cleanser, or what people do sometimes now is this double cleanse. I think they do oil first and then like a sort of a foaming one after, but be careful not to over cleanse, because
Right.
that's what we were talking about earlier, is the price you pay for getting all that makeup off is you lose your natural oil too. And then, yes, you better moisturize after, put some of it back. But so it just depends on the makeup, but I like a primer first because it just makes everything sort of like sit up a little higher on the skin, not get into the pores as much.
I love that. Okay, so for ladies, let's use our primer. I think we do that anyway. I just don't do it
And
every.
get one with a sunscreen built into it. That's what I do. That's all I wear. Is mine is a primer that it has like an SPF 30 in it, and it has a little bit of like an iridescence, like a little rosy glow. I put one product on, I got my rosy glow, got my sunscreen, and like my little primer doesn't feel
All in
oily.
one.
Yeah,
I
$30 done.
Yeah, tell me about that. All right. All right. So let's take a quick break then. And then when we get back, let's talk about hair loss. Let's talk because that's a big thing over here as well, especially for African American, not just hair, but just African American
True.
women in general. Pulling, the tugging, the brushing, the
Yes.
relaxing, and all this other stuff with the hair. Um,
Yes.
is
Good
a
topic.
huge problem. All right. So let's take a break real quick, Beats. Right after this, we'll talk about the hair loss.
Good music.
Right, so we're on a break. Beats, I see where there's a third box there. You want to talk or you just have it there? I could see it on the screen. You have any questions? Oh, I think Beats has questions.
I don't have a question. That was so I could add the music in.
Oh, I thought you wanted to. You have me all excited because you come with these questions, and you absolutely have no questions for our dermatologist today.
Would you ask me a question? Ask me a question.
I put some there. Well, I wanted to know, is there like an at-home litmus test to know if you have oily or dry skin?
Ah, so not exactly. I would say you would already know. Like, right? And there isn't just two categories of that. But I would say, so at the end of a workday, I'm like, ew, right? Oily. Some people at the end of the workday, they don't feel, ew, oily. So they might be a drier skin type, but it isn't that it's one or the other. And sometimes your face can have two different zones, oily here in the sort of T zone and dry out here, right? So that is a really good question, how to determine your skin type. But there are 16 defined skin types, not oily or dry, but all the products say for oily skin, for dry skin, or they might say combination or normal skin, right? But it doesn't boil down to those three simple categories at all. So at the end of the day, how does your skin feel? Are you like, ew, oily or not oily?
For the majority of the day, my skin feels oily.
Yeah. So I would say you're probably more of an oily skin type. So therefore, certainly at the end of the day, you could probably get away with a little bit more of a foaming face wash, just something that foams up a little bit.
Okay, I
And
have another question.
oh,
Now, this one, I saw this TikTok of this young scientist. He's a young man who he did this study where he was the only person in the study, but he did not bathe for a year to
and
test and see, what effect that had on his acne. And it actually turned out that his skin improved.
he's lucky. That's not what I would expect. But that's study with one guy.
Exactly. It's just one
One
guy.
guy. No.
But
So yeah,
for,
go on.
but for myself, I've noticed that when I use certain products on my skin, like I would have no bumps, no flare ups, but when I use certain products on my skin, or I y- take advantage of my wife's, facial products, and I use
Mhm.
them, then I'd start to notice, oh, I have a pimple today. I'm like, I just washed my face.
Yeah. So we just have to find things that are compatible with you. And also there's so many variables. The thing is, yeah, sure, you might have borrowed her face wash that day and then got a pimple, but what we have to consider also is, what kind of stress were you under in the few days before? Did you, were you out in the hot sun on the boat, or, was there salt? Like all these other factors. So we have to be very careful not to make a causation out of something that might not be actually the case, right? But it's easy to say, well, I used a different face wash this day and got a pimple, therefore it's the face wash. But the whole day and the whole previous days have to be considered
Sorry,
also.
before you ask a question, Pete, are we back on live or are you still on okay, good. All right, go ahead.
Yeah, so that's all. And not every product is compatible with every skin type either. And hers might be medicated. Um, it might have retinol or salicylic acid or benzoyl peroxide in there, and that could actually irritate you a little. I don't know. We'd have to see what the product is. But here's the thing: the skin will misbehave for no real discernible, predictable reason. And so this guy who didn't bathe for a year, what I can guarantee you is he had some dandruff, and if it helped his skin, great. That's unique to him. It doesn't mean that applies across the board, because it certainly can be the opposite.
Okay. Wow. Welcome back. Listen, we having so much fun here. We having so much fun. During our break, we had Pete asking all kind of questions, right? But here's something that Pete said that happens in my home as well. My husband uses my facial products as well to cleanse his face. Is there a difference, or is it okay? I mean, because I use the Neutrogena instead of Cetaphil products, so
Mhm.
I guess it's fine. But should there be a different type of facial wash for him versus me? His face, gee, it's not dry, neither is it oily. So I don't know. It's neutral. I've never seen him with harsh, dry skin. Neither have I seen him with oily skin. So,
He's
and the
lucky.
products I use are more the creamy from Cetaphil now. But back then I used to use another brand that caused it to be very dry. So I just, I'm in and out of products trying to see what works from what doesn't work.
Yeah,
Uh,
and I'm telling a
yeah.
story a lot of people experience, which is, rotating through different products.
Mhm.
The but once you kind of know what general category to look for, we'll talk about your husband in a second, but for you, creamy, not so much foamy. And then you can pick the brand you want. It's almost less relevant the particular brand as that you choose their gentle, creamier product of that brand, right? Because most brands will have that selection. They'll have sort of their creamy, gentle washes, they're sort of semi foaming, and then they're like full on foaming. So you just have to be careful when, no matter what brand, you look for their gentle, not foamy product, right? And so your husband, if he's got this pretty neutral skin, he might be able to get away with using anything. And again, it's not a should have a different product. It's what are his goals and what does his skin
He
look
don't
like?
care with no skin infection.
Yeah, let's
He
cross
just
it.
washing his face,
He
and
just
I just stopped him from using Caress and Dove soap to wash his face, and he's using.
does it bother him?
It
Why
doesn't bother
stop him?
him. Because I feel as if, okay, this is for the body, this is not a facial soap. I know Dove is very soft inside. I love Dove, right?
We use stuff on
And
the face all the
right,
time.
right. But I was thinking, okay, if you're gonna use the stuff, you could use my Cetaphil for your face, it's fine. But he has no skin issues, no nothing. He just uses
Right.
it.
So then for him, what I would say is if you like it and it doesn't bother you, use it. I don't even care what it is. Right. So there's no should for him. It's just if you don't care and it doesn't bother you one way or the other, and your wife doesn't get mad at you for stealing it from her, then use it. Right. So I'm very practical in that way. There's no particular products in that sense. I just say a lot of
So
people
men
come in as
have a different type of facial cleanser than women.
not strictly based on gender, not strictly based on gender. I would say a man with oilier skin and even a woman with oilier skin is going to have something different than a man with dry skin or a woman with dry skin, right? So not straight up gender. It's just what kind of skin do you have?
Yeah, good. So his is fine. So he can go ahead and use whatever he wants to use.
Pretty
Just
much.
use it. Go ahead. All right, let's talk about hair loss. Let's talk about hair
Yeah.
loss. How do
Important
we
topic.
I know for few, and especially for me, with my three kids, each time I had them, I've had issues with hair loss because of pregnancy.
Yeah.
Grew back, which is fine. And then my hair was natural at a point, and I had locks
Hmm.
at a point, and then I lose them out. They're beautiful, whatever have you. So my hair was natural. And then I started relaxing my hair again, and it started to get thin again to the point where I'm very uncomfortable to this day. I'm still uncomfortable because of the result of using too much of that relaxer and chemicals in my hair, that I do not wear my hair natural as often as I should. Maybe I should start doing it again, but that would only come if I use a certain, because I've tried so many different things on different places where people say, "Oh, if you use this oil, it will grow and it'll thicken," but it has never happened. I don't know if it's because I was being inconsistent and impatient, but I know I all over the place. I just taking advantage of you.
Thank you. I'm tracking though. I'm tracking because you brought up so many important points
Yeah.
right there. So
So I'm like, I just stopped. I'm like, anyway, I'm just gonna do my regular hair washing routine. I wear my natural hair when I'm at home or if I'm going jogging or something, or sometimes I just put a headband over my head. But we have a lot of women who suffer from hair loss and particularly alopecia because of, chemical burns, because of stress. Of course, you're the professional. Go ahead, do what you do.
so here's the thing. So the word alopecia simply means hair loss. It doesn't imply the reason for the hair loss. So when somebody says, I have alopecia, right, the next question is, what kind of alopecia,
Okay.
right? So alopecia can be a whole spectrum of things that you have reviewed. There's telogen effluvium, which is a stress shed, pregnancy, fever, surgery, car accident, anything that stresses the body, um, even just work stress or life stress, will cause a hair shedding. So that is a type of alopecia called telogen effluvium. You also described, well, we all know that there's a type of alopecia that's genetic, right? Mom
Mhm.
had it, dad had it, grandma had it, whatever, brother has it. So androgenetic alopecia is basically sort of male pattern or female pattern hair loss that's genetically programmed. Different treatments for that.
Mhm.
You also described, what we call a cicatricial alopecia or scarring from maybe relaxers killing off follicles. We used to think hot oil, from hot combing killed off some follicles. So there's a type of scarring hair loss in generally in people with African origins in their skin, not related to actual hair care, but more of for some reason, it's programmed in differently called central centrifugal alopecia, right? So when you see somebody selling this product will fix alopecia how can it fix alopecia if it's from telogen effluvium or it's scarring? Like it can't fix all alopecia. So what kind of alopecia do you have? Right? And there's also there's a million other kinds. There's lupus alopecia. There's thyroid disease alopecia, right? So like alopecia areata, where you get these little individual bald spots.
Mm-hmm.
They grow back, but that's from thyroid disease. So you're not going to put any shampoo from the salon on that to fix that kind of alopecia. What those products are relying on is the fact that most alopecias reverse themselves.
Mm.
So you put this product on for 3-4 months. A product going to grow back hair. You know what? It was going to grow back anyway. Right? But so they got you there, right? So just get it
How
evaluated.
those that'll say, "Oh, we use mint to stimulate the follicles, and you gotta rub it in, and you gotta do it like this, and then do it like that, and then spin around and touch."
Exactly. And do a cartwheel and then right.
Then,
Oh yeah. Do you see what I'm saying? You see what I'm saying? They're just they're keeping you busy while the hair grows back by itself. Right? Because one thing the scalp does not have a problem with is blood flow and stimulation, right? You cut your scalp, you never seen so much blood. Right? You never have a lack of blood flow to the skin on the scalp. That is never the problem. Never once in my career I was like, oh, your scalp doesn't have enough blood, right? It's not why your hair is falling out. It's either telogen effluvium, androgenetic, the cicatricial varieties of alopecia, alopecia areata. You mentioned one other thing, which is processing of the hair. Breakage. So hair falls out at the root and gets thin, but hair breaks and gets thin. So processed hair, colored, straightened, etc., even washed with shampoos that are far too harsh or drying. We talked about that earlier regarding dandruff shampoos, right? Can dry that little hair shaft out, especially coily or curly hair. It's very easy and brittle. It's very easy to break. And then we cornrow it, right? We put plaits in it, or we tie it back tight to control all the curls, and it creates this thing called traction alopecia. Also, that's an important one in the Bahamas, and especially when we put plaits in and attach a hairpiece to it or extensions, it puts a lot of pressure on those little follicles that then try so hard to hold on. They put scar tissue down to hold on to those little roots. And eventually the scar tissue replaces the follicle. And
no
you
more
have,
edges. Edges gone.
right, you have yes, you've seen it. We all have seen it. Permanent hair loss. But okay, so breakage though from processing. So when I look at somebody whose hair is, thinning, we first of all have to determine if it's breakage or if it's coming out at the root. So breakage then becomes a different issue. That's hair care. That's not relaxing. That's conditioning. That's trimming. That's taking care of the actual hair shaft itself, not the follicle so much. Does that answer the question sort of loosely?
Sure does. So how do we reverse this then? I mean, because you said that there are no products that can be used for certain alopecia. Because you do have some, like for instance, with me, my hair grew back after the kids. It didn't
Yeah.
grow as full, but it grew back, after I had 3 of them. But then, you still have people with, like you said, who used to plait their hair and then it's pulling out, or with the chemical burns and it doesn't grow back. So how do you deal with that?
Yeah. So first stop is let's figure out what kind of alopecia you have. So that's where I can be useful. Is that as a medical doctor who understands, that alopecia is often a sign of something going on with your body to the extent that it can be thyroid disease. So what we do is we say, well, and it can be excessive male hormone, like we talked about for the acne previously. Some women who start to get hormonal acne, we check for hair thinning, because if they're producing too much testosterone, we'll start to see premature pattern thinning, like what you would expect, in your 60s, 70s, or 80s starts to happen early. So, right. So we look for the cause of your hair loss, determined by what's the pattern. Is it what's the timeline of it? Did it grow back after it fell out? Like for you, telogen effluvium during pregnancy. And then maybe the reason it didn't all fully come back is there could be a baseline, slowly progressive genetic hair loss, because every year we grow older, we might be manifesting just a genetic pattern hair loss as well. And then every pregnancy, you take another hit, never quite grow back all the way. Take another hit, never quite grow back all the way until, 3, 4 children later, you might be down a few follicles permanently. But so that's the question. So I'll tell you where we can help. First of all, if we can help you identify a thyroid disease or polycystic ovary syndrome, yay, that should be done. Secondly, telogen effluvium, like you have, it's time. Time is your medicine. Reassurance, possibly some topical things that might address if there is a baseline of genetics, and that's where minoxidil Rogaine comes in, right? So that you just buy at the store, but that will not help everybody with hair loss. It only helps genetic hair loss. So if somebody says, oh, here's a hair loss product, but you have thyroid disease, Rogaine's not going to help you. That's my point here is let's diagnose before we treat.
With
right?
men, with balding, how do we know? Is this also the issue? Because of course they don't have no chemical issues. I don't know if it can also be genetic.
Largely it is for men.
Yeah. What about
Yeah.
stress? Stress causes hair loss for them as well? Oh no.
Yeah, we see it. Yes, generally we can. So telogen effluvium, or this stress shed, can absolutely happen to men. It's easy to mistake that for pattern hair loss in men, but the timeline would be different. So telogen effluvium generally is a fairly quick shed over 3-4 months versus a slow marching to a receding hairline over several years. But because most people, humans, have generally are manifesting a little bit of genetic hair loss all the time, the Rogaine can't hurt. So for men, generally, we end up with something like Rogaine. There are pills.
Honestly, does it really, really work for men?
Well, yes, but not all men all the time, right? About a third of men will actually regrow hair. About a third of men will just stop losing hair. And about a third of men will get nothing, right? So it's not Rogaine's fault. Rogaine can make one guy grow hair and the other guy gets nothing. It's not that Rogaine is a bad product or Rogaine is a great product. It's just, it'll address, right? So we have to stop thinking the products are the thing. It's just how you respond to them.
Right.
So, and for some women too, women with pattern hair loss, Rogaine gets in there and it helps to protect the follicles from our own hormones, our own male hormones. So then if we have pattern hair loss in men and women, then we think about another topical product, which is spironolactone. It's harder to come by in topical form, but if we need to really block more sort of that hormone effect locally on the follicle, even we use it for women and men with hormonal acne. So we have that product too. That's prescription. That's hard to come by even here, but we can get it. There are also pills for male pattern hair loss. Finasteride, pill a day. And it, again, in this case, probably more like 60% or 2/3 of men will actually grow back hair. It simply doesn't work in women. This one is a funny one because it just simply doesn't work, or we'd have women on it all the time. So
Dr. What are the side effects of these pills? Because every time when you hear and you watch these commercials with these pills, you hear side effects,
diarrhea,
loss of erection, diarrhea, this and that, whatever. You die,
Well, so these things, while they can happen, they're very rare. And even if somebody died of a car accident while they were on treatment in the trials, in the studies for this, they have to report the death. So yes, one death on, these pills, it could have been for an unrelated cause, but they have to report that death. So be mindful when you hear those things. It's just how these studies work. They have to report anything that were to happen. So even if it's from an unrelated cause, right? So it can be misleading, but it's not, because hair loss treatments will cause death, although they could if you have an adverse reaction to them. So we have to counsel on that. But yes, loss of erection. So when we start talking about blocking testosterone receptors, they're not just in the hair follicles, they're in muscles, they're in, sort of sexual organs as well. And so, can blocking those hormones at a very mild level result in erectile dysfunction in men, loss of libido in women, or men also? But yeah, so we have to say, well, let's try the pills. If you do not notice those things as a side effect, great. Let's see if we can grow some hair. If you take those and you notice those side effects, not worth growing hair for, right?
No,
I mean, maybe it is. I don't know, but I don't think so.
I hope not. It's not worth it.
Exactly.
You know. Um,
Exactly.
so is there anything else as we wrap up today's show? It was so much fun. Oh my goodness. Is there anything else that you'd want to? Because there are other questions, but of course we're pressed for time.
Sure.
That
Well,
you
let's
wanna
talk
share.
again. I think we covered a lot of things. We covered a
Mhm.
lot of things, but I would say, so I'm in Nassau and Roxtown here, coming late part of October, early November. But if there's hair loss, get a diagnosis. Don't spend your money trying different products, because we can simply identify what the cause is and get right to the right treatment early on. You don't have to be frustrated by it, and certainly don't waste time letting more hair fall out if we can simply identify the problem.
Brother,
Always
that's
happy to help.
the money you're spending on finding out what works from what doesn't work. Just go to a professional. Jamie's right here for you. She'll be here
Yeah,
at the end of the month of October.
end of
Early
October.
part of November. So put in your, appointments now. If is it possible for them to make appointments for
Ye-
consultation?
Yes, I think they're just opening the schedule now. But yeah, at Family Medicine Center right there on Blake Road in Nassau. Yeah, for all manner of skin things, medical, surgical, cosmetic, whatever you need. But happy to give you just a thorough, evaluation, medical evaluation for hair loss. It's not simply a cosmetic issue. It's sometimes your body's saying, "Hey, there's something wrong."
Yeah.
So make sure we address that before you start using all kind of shampoos or whatever.
You good? Mhm. I can hear you.
Me?
Oh, no, no, sorry, that was
Oh,
Beats. I think he wanted to ask another question, but we're gonna wrap up, Beats. So I don't know if you wanna tell me real quick or send a text or something. But as we wrap up, I want to thank you, Dr. Jamie, for all of the information that you provided for us, for dispelling all the myths, by helping us with our mates, our brothers, our dad, our uncles, our neighbor who need this information as well. So, of course, we as women, we're not just taking the information for ourselves, but we're actually using that information to be able to help our male counterparts, our male colleagues, family members, loved ones, etc. So thank you so much for that. And of course, if you want to contact Family Medicine Center, which is always in my phone, the number to call is 702-9310. 702-9310. Dr. Jamie said that they're now opening the schedule for you to be able to see her for consultation. Come on, man. We gotta talk. We gotta take better care of ourselves, our bodies, take better care of our faces, take better care of our hair. So if you are having a constant issue with uh, dandruff, dermatitis, constant issue with trying to find out what works for your face and what doesn't. Or if you just want to prevent things from happening, you may think that your face is flawless and you want to keep that flawless face. You want to know what are some things that I can do to maintain that. That's what may have worked for me. As we age, I figured that some of the products that we used back then, we definitely don't want to use them now. Like when we were younger, Dr. Jamie said we used to use the acne, facial products and stuff. And then you had some teenagers who using the anti-aging products. Know what products works for you. And then I would also advise it's not just for you. Bring your teenagers. This is the time when they start to get, the little pimples and stuff, on their faces, and they feel a bit insecure and a little bit, shy off from having to go in the public because of their face, go and see a dermatologist. Go and check out what would work for you. Your redness, etc. Go ahead. Mhm.
I just want to add one thing. So, a dermatologist, right? So, I am a residency trained, board certified dermatologist. You'll also find some very good physicians who are family medicine doctors who practice dermatology sort of as a side interest, but
Mhm.
simply can't sort of do the evaluations that a board certified dermatologist
Mm.
can do. And I am the only one in the country of the Bahamas practicing at this time. So,
That is vital information right there.
I don't know why I didn't think
Because
of
you
that
have that
earlier.
right in the come say it again, please. You're the
Yeah, so
only person in the Bahamas that can sorry, go ahead.
that is a board certified
Uh-huh.
residency trained dermatologist. That means that I'm not doing it as sort of a side interest. It is
No.
my full time job, and I've invested my life in understanding these things from a medical standpoint. Um, let's just say this: if you do have something that's been frustrating to you that may be more complicated that nobody's been able to figure out, certainly come see me. That's literally my wheelhouse. But also very different than just sort of a side interest, or certainly very different than an esthetician or a skincare, so-called skincare
We're
expert.
not knocking them, but we're just
Not at
saying,
all. It's just
you
a
know.
different service, right? They do
Yes,
beautiful things. I have them here in my office because they do things I don't. They know all the products. I don't know all
yes,
this.
yes.
All the specialty things. But no, it's just understand that there is a difference.
There's a
That
difference.
what I'm offering you is board certified dermatology care. And like I said, there's lots of great family doctors who do dermatology or have had 6 months training or if that kind of thing. But just
Mhm.
understand that there is a difference, and I am currently the only board certified dermatologist in the Bahamas at your service.
Love it. Love it. And we had her on the show and she answered questions for y'all for free, y'all. For free.
Amazing.
Thank you so much, Dr. Jamie. You have
My
been
pleasure.
marvelous. I really appreciate you. How can people, other than reaching out to family medicine centers, there a website or somewhere that you have that we can actually reach out to you for further information?
Yeah, well, so my Minneapolis website is my practice here is Uptown Dermatology. So the website is www.uptowndermatology, UPTOWN, and then dermatology, DERMATOLOGY.com. And then you can just kind of peek in and see sort of the things we're doing up here in Minneapolis.
Mhm.
Uptowndermatology.com.
Uptowndermatology.com.
And
Now
you
that
can email me through that portal also.
And you can be emailed. Excellent. I love it. I love it. I love it. All right. Thank you so much, Dr. Jamie. Of course, today's show was just wonderful. I learned a lot. I learned a lot. I got information from me and hubby. So, of course, we'll be seeing you soon. All right. So today's show was brought to you by Airborne Freight and Cargo Services, John Shoe Store and Accessories, Your Lane Life Coaching, Bahama Odds and Ends Party Supplies, Neutrogena distributed by Lowe's Wholesale, and Women of Strength Association. I want to thank my producer Beats for holding it down. Thank you to my Facebook audience for making it happen. Guess what? Dr. Jamie is going to answer your questions individually. Okay. She's going to answer them for you when she reads them. Of course, she's going to answer them. And of course, if you want to speak with her, you can go to her website and look up the phone contact. I don't know if you accept phone call contacts or just
It's harder for me to do phone calls. It's tricky because probably the best way. Well, I'm trying to think. Even through WhatsApp, sometimes I'll stay in touch with my patients, but really the best way is an in-person
in
consultation.
person. I would think
Because
so. Yeah.
yeah, it's hard for me to do too much remote stuff because I don't get to see your skin that way.
Absolutely, absolutely. It's nothing better than the doctor actually being present to see whatever your issues may be. All right. So you can go onto a website. Can you recite the website one more time for us?
Yeah, it's Uptown Dermatology, just one word, .com, uptowndermatology.com. Worst case, look up Minneapolis Uptown Dermatology. If you search those three words, we will come up first.
Awesome. Love it. All right. All right. So of course, thank you to everyone that tuned in. Thank you for our radio audience. Thank you. And you can go to Coach Trish Hannah on YouTube to watch the previous shows. And when you do go there, please like and subscribe. I pray that you all were empowered, educated, and encouraged today. And until next time, happy Sunday, everyone.